I'm Dr. Christopher Barker, New Jersey licensed psychologist. I talk about psychological issues and sometimes some commonplace issues that may influence mental health and well-being. And welcome to Holding Space. That is something that I have been doing a lot of lately. I've been holding space for listening to, working with issues of trauma, and especially complex trauma. You'll hear me talk about this again and again. Hope you're not tired of it yet, because I'm going to keep doing it. When complex trauma can be mistaken for weakness, and how people in our lives, including coworkers and supervisors, sometimes exploit those trauma-shaped behaviors. This isn't about blaming survivors. It's about understanding the patterns that make exploitation possible and reclaiming the power that trauma once took away from you. So, complex trauma isn't a single event. Sometimes it's an absence of events. It's repeated exposure to instability, unpredictability, or emotional harm, often in childhood, but not always. And here's the part people don't talk about enough. Complex trauma reshapes behavior in ways that are adaptive in unsafe environments, but misunderstood in healthy ones. These adaptations can look like over-apologizing, avoiding conflict, freezing under pressure. You've heard that there's fight or flight. They've upgraded it. Now there's fight, flight, freeze, fawn, or faint. We can go into more of those another time. I think I've already done a couple of them, but people pleasing is another one, an adaptation. If I make all these people happy, then nothing bad will happen to me. Hypervigilance. That's a big one. Waiting for the next thing, waiting for the other shoe to drop, waiting for the next time somebody's going to do something that's like that. And that results in a sort of a complex trauma time travel. You go back to those earlier events and you scan for those. You wait for those or anything that may resemble that. You may have difficulty setting boundaries. You may be taking on too much. And that's part of people pleasing, but it's also sort of like, if I do so much that I'm so valuable, then nobody will hurt me. Minimizing your own needs. If you don't put yourself first, and I know people talk all the time about self-care as being important. Well, it is. That's why we're talking about it so much. And taking on so much and not taking care of your own needs. And yes, I know I do that too. For my friends who are watching, yes, I know I do that too. But it's really something that we need to pay attention to. They aren't flaws. They're survival strategies. And that's not just my rationalization. But in adult life, especially in workplaces, these strategies can be misread as weakness, passivity, or incompetence. And unfortunately, some people will take advantage of that. If you have a cruel or manipulative or sadistic leader, you may fall victim to this. Even if this person really doesn't come across that way to anyone else, they can become that to you. People will see that they can take advantage. They will see that there is some room here to make this person work harder or overwork. And it may come with the message of, you're doing such a good job, which is a trauma uninformed sort of thing to say. Because if you're not aware that this is playing directly into the power dynamic, that this person is having their reality defined by you, then they are going to go along with whatever you need them to do. Anything that results in praise is also restructuring their reality so that they are doing the new agenda instead of taking care of themselves. How trauma-shaped behaviors get exploited? Okay, let's be honest. Not everyone in the workplace is kind, emotionally mature, or ethical. Surprise. Some people, consciously or not, gravitate toward colleagues who seem easier to control, to silence, or to overburden. Trauma-shaped behaviors can make someone a target for workload dumping. People who struggle to say no often end up carrying the emotional and logistical labor of entire teams. I'll do it. sometimes called middle child syndrome, but often the action of someone who is trying to keep up and trying to stay safe. Credit theft. If you're conflict avoidant, someone may step in and take ownership of your work. And has that happened to you? So it's not a weakness on your part. It may be just a willingness to like, okay, well, I'll let this one go because I don't want to make waves. Boundary violations. Supervisors or coworkers may push past your limits. They sense you won't push back. Emotional manipulation. People pleasers are especially vulnerable to guilt-based tactics like, you're the only one who can do this. Or, I really need you to take this on. Silence in meetings. Trauma survivors often hesitate to speak up, and others may use that silence to dominate decisions or narratives. None of this is a supervisor's fault. It's a systemic issue, not a personal failing. It's often not something that is conscious, and sometimes supervisors do not see this happening. Because again, there are a lot of unconscious dynamics that are happening here. There are a lot of things that go on beneath the surface. Relational time disruption at work. Well, here's where complex trauma adds another layer, relational time disruption. It's something I talk a lot about in my new work. This is a trauma-driven difficulty in tracking patterns over time, especially patterns of harm. In the workplace, relational time disruption can look like not noticing how responsibilities have slowly increased or evolved, forgetting early red flags in a supervisor's behavior or a coworker's behavior, minimizing repeated disrespect because each incident feels isolated. It may be part of a pattern that you are not allowing yourself to see. Or you may actually be embracing that pattern because it's something that you know. We all gravitate towards the things that we know. And even if it's not a good thing. Losing track of how long you've been overworking. Feeling confused about whether something really happened the way you remember. And again, whether that's deliberate gaslighting or whether that's just doubt and insecurity on your part, it does not mean you're weak or insecure. It just means that you're having a moment in which you're having trouble tracking. And part of that has to do with dissociation. Dissociation is a function of anxiety in which you step outside yourself in the current timeline. You step outside the current timeline because it's intolerable. When pressure seems intense, you space out, you feel foggy. Brain fog is often invoked, but it's not just brain fog, it's being somewhere else. It's not that survivors don't see what happens. It's that trauma has rewired your system that detects escalations. You cannot see the buildup. You cannot see the pattern emerging. Why trauma looks like weakness to the wrong people. Let's be clear. Trauma responses are not weaknesses. They're adaptations. But in environments built around hierarchy, competition, or productivity, trauma responses can be misinterpreted. To the wrong kind of person, trauma-shaped behaviors can look like compliance, passivity, lack of confidence, lack of leadership potential, willingness to overextend, emotional softness, or someone who won't fight back and will basically do whatever I want them to. And people who seek power or who lack empathy may exploit those traits to elevate themselves. On an earlier podcast, I talked about functional psychopathy and how some people who don't really care about the feelings of other people can rise to the top. Well, this is part of how they do it. This is especially true in workplaces with poor leadership, high stress, undefined roles, competitive culture, lack of accountability. In other words, many workplaces. The emotional cost of being exploited at work. Of course, there is the inevitable burnout. We know what that looks like. Self-doubt, imposter syndrome, feeling invisible, feeling used, feeling exploited, loss of trust in professional environments. And it reinforces the old trauma narratives. If something keeps happening again and again, especially if it happens sporadically or not every single time, but often, the reinforcement becomes more concrete. It becomes stronger. The association becomes stronger. If we're waiting for something and it happens every third time, we're much more likely to be waiting for it on the fifth, the sixth, the seventh time, even if it doesn't come until the 10th time. And that increases the hypervigilance, making us less sound, less sure, less aware. It reinforces that old trauma narrative. It can even recreate the emotional dynamics of earlier trauma, being overpowered, unheard, or taken advantage of, or just being uncertain of what's going to happen next. When no one sounds the safety whistle, when no one tells you that everything's okay, you're waiting for the next thing to happen. This is why workplace exploitation hits survivors harder. It's not just about the job. It's about the nervous system recognizing an old pattern. Technically, it has nothing to do with the workplace at all, except this is like one of the primary places where power dynamics can happen. And power dynamics frequently fit into the complex trauma paradigm. What survivors need to hear. I'm trying to incorporate this more and more into the podcasts that we do here. If you're listening or thinking, this is me, I want you to hear this clearly. Your trauma responses are not weakness. They kept you alive. People exploiting you is a reflection of them, not you. You are allowed to set boundaries. You are allowed to say no. You are allowed to take up space. You deserve workplaces that value you, not drain you. And most importantly, you are not imagining it. If something feels off, it probably is. It's certainly worthy of taking a look at. Thank you for joining me for this conversation. Thank you for holding space. I encourage you to like, subscribe, leave comments, leave questions. If you have something that you really need to know about and something that you want to discuss that relates to this topic or you want to see developed further, please let me know and I will be glad to do so because this stuff is important. These things that relate to how we survive in the world are really important. Thank you for holding space with me today. I'll see you soon.